topic of the talk today was talking about allergen cross-reactors.
Do you think this topic is important?
Well, let's take, for instance, if somebody was allergic to propylene glycol, and we just included products, we just told people to go look for a product that's free of propylene glycol, they could react to a product that had propylene glycol stearate in it or some other propylene glycol derivative. So when we're trying to make a database to come up with products that are safe for individuals to use, it not only has to avoid the allergen, but it has to avoid certain related allergens that are likely to cross-react.
And how do you decide when something is whether it's a co-reactor or whether it's cross-reacting?
The difference between a co-reaction and a cross-reaction, you have to have a logical explanation. So if things are chemically related, you say, gee, these chemicals probably truly cross-react. But take an example of a co-reaction, neomycin and bacitracin. They're not chemically related, so we don't think they cross-react. We think that they really both are commonly found as allergies in the same individual because they're both used on damaged skin that is likely to cause sensitization. So they're not a true cross-reaction, they're a co-reaction.
Any comments on corticosteroids and how they cross-react?
Steroids are probably the toughest group that we had to deal with the contact allergy management program. We know that steroids are divided into 5 different structural categories based on molecular structure, groups A, B, C, D1, and D2. And we have testing ingredients for all of those, representative testing ingredients, on the American Contact Dermatitis Society's core allergen series. And the problem is that there are oftentimes cross-reactions between these different groups. So not only will somebody allergic to an item in category A be allergic to other group A steroids, but they might cross-react with other groups. And the problem is, if we consider all steroids to be cross-reactors, then somebody uses our database, they look for a safe steroid, and they won't find any. So currently we've made the decision to only include items that are in the same structural group as cross-reactors. And what that means is that our members have to tell their patients that if they're allergic to, say, a group A steroid, they need to avoid group A steroids, but any other steroid that's proposed, they should do a repeat application test with the proposed steroid by applying it twice a day to the fold of one arm for 2 weeks to be sure that no reactions occur before using it on affected skin, because CAMP won't do that for them in this case.